Hello, everyone. I'm Danita Chantel, and welcome back to another episode of Bella TV. I'm here with the very intelligent Dr. Glenn
Thank
Babus,
you.
who is a pain management specialist. He's been in practice for about 20 plus years,
Yeah,
doing
that's
some
correct.
great things with treating patients that have pain. And he's just opened up a new practice on Park Avenue. Doctor, thank you for stopping by.
Thanks for having me.
So, talk to us a little bit about how you got started in pain management.
You know, I was always so amazed when I did my internship and residency through some really big hospitals, big trauma hospitals. And I was always so amazed how people would be in these amazing car wrecks and they would heal, like amazing access and traumas, and some would just get better. And there would be this small percentage of people that just wouldn't get better, would have this kind of chronic pain. And I did something with the chronic pain service, and I was just amazed how they were able to help those patients. And that kind of related to me.
It related to you.
Yeah.
Now, you mentioned to me off camera that you practiced and started in New Orleans with your internship.
Yeah, did our internship in Charity Hospital.
And then you went
Famous Charity Hospital.
You went on the tough place where you mentioned.
Tough spot.
And then you went to practice in Texas.
In Houston.
In Houston, Texas.
To the UT, it's MD Anderson, Texas Heart. They have a very large university medical center in Houston. Still do.
And then something brought you up here to the Northeast states. Huh?
Love. My wife hated humidity. So, and we wanted to be closer to our family up in New York.
All right. Now back to what we were talking about earlier. You opened up a practice on Park Avenue. Talk to our viewers about the practice.
Well, medicine has changed so much in the last 20 years. So as a pain management doctor, we could only inject steroid and local. There were only things we could do. And then some smart people in 2001 came up with an idea of centrifuging blood and came up with packed red blood cells, and they were injecting athletes. And that got into the general public, and then stem cells. And medicine has advanced so much. So instead of injecting steroids into joints, which have their issues, we're able to inject people's blood products and stem cells from their fat and bone marrow into their own bodies to help them.
And the name of the practice is Cellience.
Correct.
Cellience. And now, how did you come up with that name?
Well, I have a very smart son. He's actually has an art gallery, and he came up with that idea because we were thinking of, what are we going to name it? The Dr. Babus Institute. There's a lot of institutes.
Yes.
I want to keep away from it can't be an institute, the 50th institute. So I like that idea because that's what it is. They're cells and it's a science. So we like the idea of those together, and then it all jive with the whole family and everyone else who's dealing with the business.
And as you mentioned, it's more of a boutique type of practice, which is very hands-on, giving you 5-star treatment, making people feel comfortable. What is that approach?
I always miss the old days because, when I was a kid, used to have the doctors give house calls. Would come to your house, and there's some, that's getting popular even in New York, but, people would come to you and they would come to the house, and you didn't have to go to the pharmacy, and they had their antibiotics. They would do little procedures in your house, and that was so nice. And, with medicine and a big pain practice where I'm, with orthopedic neurology, we're seeing a lot of patients, and you always would like to spend more time, and sometimes that's hard to do. And especially with this regenerative medicine, half of it is the injection, but the other half part is really training them in lifestyle choices, the right exercises, the right food. And so, we want to give them enough time so we have success. So patients come in and they get their own suite, basically. We kind of develop it to be kind of like a very comfortable room for people to come with their families to hang out as they get their injections. And we find that, I tell you the truth, I think it increases your success rate.
I think so too.
Yeah.
Now, you mentioned regenerative medicine. That's more like a non-surgical, non-invasive approach. Can you talk to our viewers about that? That's listening at home, we think like this.
I guess for people, when they think of surgery, they think of an incision in the skin, some kind of cut.
Right.
And what we do, we use very small needles to inject our stem cells and blood products into the joint or disc or muscles. And we use a guidance technique. It's called fluoroscopy. All it is 2-dimensional X-ray. So we can use real X-ray, and we know our needle hits the spot. Or in some tissues, it's better to use ultrasound. That's another way to watch. And they've done studies to show that people who don't use these techniques sometimes has high as 60% failure rate of not even being in the right spot. So the key is, if you're not in the right spot and you inject, you're going to fail.
So
So
you're
that's
imaging and
imaging is paramount.
and what type?
Unless you're Superman,
Oh.
then you can just look at it. You need the X-ray vision.
And what type of patients come by your practice?
Our practice in New York does center on a very active person, and it doesn't have to be an athlete. It doesn't have to be a pro athlete. We see a lot of recreational tennis players, hikers, CrossFitters. People just want to go to the gym. But I was just telling you earlier, we had two patients today who were totally different. One was an older individual who just wanted to be able to walk better, doesn't want knee surgery, was looking for another option. The other one was, your good recreational tennis player who just wants to keep on playing tennis. So it's a variety of patients, but most of them have in common, they have one area that's hurting them that, has not been helped by traditional medicine, and they're looking for another option.
So you mentioned that you not only can get the athlete, but then the everyday person that's pretty
Of
active that
course,
wants
that's
to.
your biggest, and especially in Manhattan, it's a type A personality in Manhattan. People are, the people I know, they want to be in their basketball leagues. They want to play on the Goldman Sachs
Yeah.
league. They're playing tennis. They're hiking. They're surfing. They're golfing. It's a very active lifestyle.
And can you talk a little bit about the stem cell with regenerative medicine and what that approach that you use to medicine? Not only do you use stem cells, but also there's another technique you mentioned to me.
Well, the blood, and this is something that's confusing because I think it's a lot of marketing that's out there, and people
Okay.
are confused when they, hear PRP or A2M or amniotic fluid, that's stem cells. Those aren't stem cells.
Okay.
So it's really divided into two separate things. So stem cells are what we can get from your body from the bone marrow fat. Those are actually mesenchymal stem cells that supposedly can help with decreasing inflammatory and growing cells. And then there are blood products where we can take your blood and we can centrifuge it at different speeds and do certain filtering and take things out. And one of the big innovations that I'm looking at is alpha-2 macroglobin. A2M is I think a game changer over the last year and a half. I actually got it in my knees. It's pretty good. So what it does is we take your blood, we spin it, we filter it, and we're able to really get it down to that what's called PPP. It's platelet poor plasma, less white blood cells with the alpha-2, and we find that's an incredible anti-inflammatory.
Oh.
And what it does, it's like, when you're ready to plant your lawn,
Yeah.
you want to put the seed. This is putting the seed down, so it decreases the inflammation before we put the stem cells. It helps the stem cells to work better. But it's a standalone treatment too. In fact, one of the people we did today, they were probably only going to get the alpha-2 macroglobin.
So with that type of treatment, that's great for like people with arthritis or having
arthritis, tendinitis, bursitis, inflammation, bad muscle spasms, trigger points, tendon tears, rotator cuff tears. We do a lot of work in the back. We inject discs for people who've had disc bulges and tears.
Now, what would be how long would that last? Like depending, I know it varies from patient to patient.
It does. There's a big variability. There are two interesting studies that are out. One is with bone marrow and one is with amniotic fluid. And they have people going out over 2 years with 50% or greater relief. So
wow.
the results are good. We have our own people that are going out 1 year and 2 years. The nice thing is we have a good group of people around the country that we're able to talk to. The person that I use, as Catalyst, they have a good group of physicians. So we can combine our data. So, I could talk to a guy in San Francisco. I say, how's that working for you? So instead of just your data, you can get 100 physicians' data and see, what's working. And what we're seeing is that A2M, bone marrow stems, we're getting good results.
Wow. So when we go to your practice, we'll get great care as well as getting some good results with all the data and your approach to treating pain.
We do have an espresso machine.
And you do have an espresso machine.
Yes,
and you're featured in our latest issue of Bella Magazine and the next issue that's coming up. Can you tell us your website so we can go and check out what you do?
It's just our name, www.cellience.org. That website is a really good website. It gives you a great overview of what we're doing, what about me, and people make a good decision where they want to come to see us.
Right. I think that it would be a great practice for people to go see you as far as pain management and your approach. It's very innovative. You're moving above the trends in medicine.
I'm very
It's
competitive.
Oh, you are.
I'm
Hey,
like,
who wouldn't want to go to see a doctor
I
that's very
can't help
competitive,
it. It's like if I'm in the street of New York and I see
Yeah.
people walking faster, I got to go faster. I like my patients to do really well.
Yeah.
You know, I get so much enjoyment when I see a patient playing tennis or a patient's like, we did 2 people a few weeks ago and he's playing golf again.
Wow.
The key is we want to see that longevity. We want to see people going, you know, we like to see year, 2 year, 3 year. We're looking for people going long distance with what we're doing. And we get excited. We love when someone says, you know, I just played in a golf tournament and I did really well. And I said, that's great. Or, you know, someone did a sport or they went hiking. You know, I was able to go with my family to Kenya and hike around. You know, we like to see that.
So longevity with pain management and results. And that's what's
That's
important.
what we are, results driven.
Yeah. And that's quality care.
Yeah, of course, you know.
Well,
I treat everyone like they're my family.
Well, we feel like you're our family too here at Bella TV.
We appreciate it.
Oh, thank you. Well, make sure you guys check out the doctor's blog and check out our magazine article about him. And go to BellaNYMag.com. And Doc, can you give them your website again?
It's www.cellience.org.
And Cellience.com now.
soon to be hopefully .com. But it's like I said, it's a good beginning for to get a good view of what's going out there.
Oh, well, thank you so much for stopping by.
Thank you for having me. Really enjoyed coming.
Oh, thank you.